How is an anxiety disorder diagnosed? Discover how anxiety disorders are diagnosed, including assessment criteria, differential diagnoses, and available treatments. Have you ever found yourself dwelling on negative thoughts, imagining the worst-case scenario in every situation? Do you feel that uncomfortable sensation in your chest, as if the world were about to collapse at any moment? If you've identified these symptoms, you may be facing a picture of anxiety. But don't worry, not all anxiety necessarily indicates a disorder. After all, anxiety is a natural emotion that prepares us to face challenging situations. It's that feeling that gives you butterflies in your stomach before an important presentation, for example. The problem arises when this anxiety becomes excessive, persistent, and starts to interfere with your daily life. If this is your case, you might be wondering, how is an anxiety disorder diagnosed? In this article, I'll explain the diagnostic process, from the first signs to the treatment plan. I'll give you that little push to seek the professional help you deserve. Let's get started. 1. Initial assessment, understanding the symptoms. When seeking to diagnose an anxiety disorder, the first crucial step is to conduct an initial assessment of the patient's symptoms. During this phase, the doctor or mental health professional pays special attention to understanding the nature of the patient's symptoms. Through careful questioning and attentive listening, they will seek to deeply understand your symptoms, including: what are your symptoms? Excessive worry, irritability, difficulty concentrating, muscle tension, insomnia, and panic attacks are some examples of common symptoms associated with anxiety. It's important to describe each symptom in detail, such as its intensity, frequency, and duration. How long have you been experiencing them? The duration of symptoms is an important factor for diagnosis. Knowing when they first appeared and how they have manifested over time can provide valuable clues about the nature of your anxiety. What is the severity of your symptoms? Do they interfere with your professional, social, or personal life? Evaluating the severity of your symptoms helps determine the impact of anxiety on different areas of your life and the level of treatment need. Are there any triggers for your symptoms? Identifying potential triggers for anxiety, such as specific events or situations, can provide valuable information for diagnosis and appropriate treatment. 2. Physical examination and laboratory tests. Given that anxiety symptoms may be related to other medical conditions, it is important to rule out any underlying physical problems that may be contributing to the patient's symptoms. Therefore, it is crucial to conduct a comprehensive physical examination to rule out other underlying medical conditions that may be contributing to your anxiety. The mental health professional will perform a thorough physical examination, aiming to identify signs of thyroid problems. An overactive thyroid, hyperthyroidism, can cause symptoms such as nervousness, palpitations, insomnia, and tremors, similar to those of anxiety. Hormonal imbalances. Changes in hormone levels, such as cortisol, testosterone, and estrogen, can influence anxiety. Nutritional deficiencies. Lack of vitamins and minerals, such as vitamin B12, magnesium, and iron, can contribute to anxiety symptoms. Other medical conditions. Heart disease, diabetes, respiratory problems, and sleep disorders may present symptoms that resemble anxiety. To complement the physical examination, the mental health professional may request various laboratory tests, such as thyroid tests. Evaluate levels of thyroid hormones, T3, T4, and TSH, to check for hyperthyroidism or hypothyroidism. Blood tests. Analyze levels of vitamins, minerals, hormones, and other elements important for the functioning of the body. Electrocardiogram, ECG. Assess the electrical activity of the heart and can detect heart problems that may cause symptoms such as palpitations and tachycardia. Other tests. Depending on the symptoms presented, the professional may request other specific tests to rule out other medical conditions. 3. Psychological assessment, understanding the patient's mental framework. In addition to the physical assessment, mental health professionals will also conduct a detailed psychological assessment to comprehend the patient's mental framework. This may include structured interviews. These interviews provide an opportunity for the patient to share details about their symptoms and personal history. They are conducted in an organized and directed manner, allowing for a profound evaluation of the patient's condition. Standardized questionnaires. Utilization of specific and standardized questionnaires designed to quantify the severity of anxiety symptoms. These questionnaires offer an objective and comparable measure of symptom intensity, aiding in diagnosis formulation. Symptom assessment scales. Employment of symptom assessment scales allows mental health professionals to measure the impact of anxiety on different areas of the patient's life. These scales help identify the extent of functional impairment caused by the anxiety disorder. 4. Diagnostic criteria, fitting into clinical criteria. To be diagnosed with an anxiety disorder, the patient must meet the criteria established in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is the primary classification system used by mental health professionals. For a patient to be successfully diagnosed, it is necessary for them to meet the following criteria. Presence of anxiety symptoms. The patient must exhibit consistent anxiety symptoms, such as excessive worry, irritability, difficulty concentrating, muscle tension, insomnia, and panic attacks. These symptoms may manifest in various forms and should be observed over a specified period. Duration of symptoms. Anxiety symptoms must be present for a specific period of time, as determined by the criteria outlined in the DSM-5. This duration is crucial to distinguish transient anxiety episodes from a diagnosable anxiety disorder. Impact on daily life. In addition to symptom presence, it is essential that these symptoms cause a significant impact on the patient's daily life. This may include interference with professional, social, academic, or personal activities, negatively affecting their quality of life and overall functioning. 5. Differential diagnosis, excluding other medical and psychiatric conditions. Conducting a differential diagnosis is paramount to distinguish an anxiety disorder from other medical and psychiatric conditions that may present similar symptoms. This necessitates a thorough evaluation of the patient's symptoms, as well as a detailed review of their medical and psychiatric history. Several conditions may share common symptoms with anxiety, making a differential diagnosis essential for appropriate treatment. Some of these conditions include depression. Depression may exhibit symptoms overlapping with anxiety, such as feelings of sadness, hopelessness, and loss of interest in previously enjoyed activities. However, the predominant nature of the symptoms, as well as their impact on daily function, can help distinguish between the two disorders. Bipolar disorder. Bipolar disorder may encompass episodes of depression, mania, and hypomania, which can be mistaken for anxiety symptoms. A comprehensive assessment of the patient's mood, energy, and behavior over time is crucial for differentiation between bipolar disorder and anxiety. Post-traumatic stress disorder, PTSD. PTSD may share symptoms of autonomic hyperactivity, avoidance, and re-experiencing traumatic events with anxiety disorders. However, the nature of symptom triggers and the presence of flashbacks or intrusive memories are distinctive features of PTSD. Obsessive-compulsive disorder, OCD. OCD is characterized by obsessions and compulsions that may overlap with anxiety symptoms, especially when involving excessive safety concerns or checking rituals. However, The specific nature of intrusive thoughts and compulsive behaviors can differentiate OCD from generalized anxiety. By identifying and ruling out other medical and psychiatric conditions that may be contributing to the patient's symptoms, mental health professionals can ensure an accurate diagnosis and an effective treatment plan for the anxiety disorder. 6. Individualized treatment plan toward triumph. Upon receiving a precise diagnosis, the mental health professional will undertake to craft an individualized treatment plan tailored to your specific needs. This plan may encompass various therapeutic approaches and strategies, such as cognitive behavioral therapy, CBT. CBT is an effective therapeutic approach for anxiety treatment, focused on identifying and modifying negative thought patterns and dysfunctional behaviors. By learning to recognize and challenge these patterns, you can develop skills to cope with anxiety more adaptively. Medication. In certain cases, the use of medication may be recommended to alleviate anxiety symptoms. These medications may include antidepressants, anxiolytics, or beta blockers, depending on the severity of symptoms and the individual needs of the patient. It is important to discuss the potential benefits and side effects of any medication with your doctor. Relaxation techniques. Incorporating relaxation techniques can be an integral part of the anxiety treatment plan. Practices such as diaphragmatic breathing, mindfulness meditation, yoga, and biofeedback can help reduce stress response and promote a sense of calm and well-being. Lifestyle changes. Adopting a healthy lifestyle can have a significant impact on anxiety management. This includes maintaining a balanced diet, regularly exercising, establishing a proper sleep routine, and avoiding substances such as alcohol, caffeine, and tobacco, which can exacerbate anxiety symptoms. Remember that each individual is unique and may respond differently to various forms of treatment. Therefore, it is important to collaborate closely with your mental health professional to develop a treatment plan that meets your specific needs and goals. Do not let anxiety rule your life. By seeking professional help, you are demonstrating strength and commitment to your own well-being. Frequently asked questions. Question 1. Can anxiety be diagnosed by a general practitioner, or is it necessary to consult a mental health specialist? While a general practitioner can conduct an initial assessment of anxiety, a mental health specialist, such as a psychologist or psychiatrist, is often recommended for a more accurate diagnosis and personalized treatment plan. Question 2. What are the main criteria used to diagnose an anxiety disorder? The primary criteria include the presence of anxiety symptoms for a specific period of time, along with a significant impact on the patient's daily life, as defined by the DSM-5. Question 3. What are the main differences between normal anxiety and an anxiety disorder? Normal anxiety is a natural response to stress and can be helpful in certain situations, whereas an anxiety disorder is a medical condition that causes excessive worry and debilitating symptoms that interfere with the patient's daily life. Question 4. What treatments are available for anxiety disorder? Treatments may include cognitive behavioral therapy, medication, relaxation techniques, and lifestyle changes, depending on the severity of symptoms and the individual needs of the patient. Question 5. Can anxiety be completely cured? While there is no definitive cure for anxiety, many people are able to successfully manage their symptoms and lead a healthy, productive life with proper treatment and support. We have reached the end of the audio. How is an anxiety disorder diagnosed? Did you like this content? Share with someone who needs support right now.